I'm Alan McFarlane. Welcome to the Friday edition of Conversations with Alan McFarlane. Fridays, we connect with medical and health professionals to talk about the impact of COVID-19. Certainly, the topic of the day around the country, everywhere, is the consequences of the police action that resulted in the loss of life, the killing, the murder of George Floyd, and that activity has impacted Twin Cities, South Minneapolis in particular, but all of Twin Cities, and has impacted communities around the country and around the world. There have been massive protests, and in many cases, the protests have included side bands of destruction, and some call it riot, some call it rebellion, some call it uprising, but any way you look at it, things are different. Things are different because these two calamities sort of sandwich each other. Our lives are changed by the impact, the presence of COVID-19. And we know that that has had a particularly devastating impact on Black and Brown people. That's true here, and it's true across the country. And you add to that the horror of I guess I call it the trauma of us watching on social media and on news the 8 minute and 46-second arrest and death of George Floyd. What impact is it having on our individual minds, our psyche, in our communities? And then, the aftermath. Communities that are in many ways experience looting, destruction, fires, etc. So we want to have a conversation about that, and we invite you, if you can join the conversation, to like and share this conversation on Facebook. Check us out on YouTube. And you can send questions to us on Facebook as well. We'll try to monitor the Facebook stream and ask your questions or bring your ideas into this conversation as well. Let me start by talking to Brother Cavis Adams. He's currently a resident and a native of North Minneapolis. He's a 21-year veteran of the Minneapolis Fire Department and member of the Minneapolis African American Professional Firefighters Association. He currently serves as a battalion chief for one of the city's 5 fire districts. Chief Adams has a bachelor's degree, a Bachelor of Arts degree in Spanish from the University of Minnesota, and he is a published author. Chief Adams, thank you for being here. And let me start with you. And after that, I'm going to introduce the other guest that's on board right now. And that's Sandy Johnson. We'll come back to you in a minute, Sandy. Chief, how you doing?
Good. Thank you for having me. It's good to be here.
We started off these Friday sessions supported by and instigated by the Minnesota Association for the National Medical Association. Huge props and thanks to Dr. Inel Rosario for convening and bringing us together for these conversations. But the general premise is, in the age of COVID-19, what discussions are we having and should we be having in the Black community? So I want to start that with you, from your position as a professional, as a frontline person, a first responder. What do you see? What do you think? What do you want people to know in our community about how we respond to COVID-19? How do we keep ourselves safe and be preventive in our daily life?
Well, I could say, judging from, just taking a perspective of a first responder and a fire department, the protocols we sort of have in place, the nature of our business and the way we look at things is there's the preventive end, the preventive side, the fortification side, and then when things go bad, if and when things go bad, we want to come in and mitigate and limit the damage. So that being said, whether that applies to different types of crises, and in this case with the COVID, from a nutritional standpoint, I would say that's what fortification would look like. Sort of, we've sort of inherited a mantra of well, people used to like to refer to it previously as slave plantation foods, the things that taste good and we salt it up and, high fats and everything. And I think as far as fortifying our bodies and our immune systems, that's sort of the sort of things we got to try and do better with. And, I always tell people if it's too hard to eliminate certain things from the diet, add in healthy things, on one end as much as possible. And by nature, you're going to push out some of the other bad stuff because you only have a certain amount of room in your stomach. So that being said, that will be on the preventive end, like just sort of fortifying our immune systems, laying off much of the processed and animal products and salts, trying to get nutritional things on board. And that will help us be more fortified to defend against not only COVID, but a lot of the other health related concerns that plague us disproportionately. In terms of our responding to active manifest COVID cases, we sort of do the gloves and the N95s we have for certain situations and, the face masks and sort of those protocols that have been put into place institutionally. They can do things to help, on that end. But I still believe, the strongest defense is the one that's taken as a preventive measure.
I'm going to ask you to talk about your personal story, Chief. People need to know Northside guy, community member, and the value of this conversation is that we kind of are assembling here as neighbors, friends, and family, and our stories and our lives intertwine. And I think we're demonstrating this affinity between us, and as we discuss and ask each other and learn, hopefully what comes out of this for those who are listening on and watching on Facebook and on YouTube is a feeling that we're sitting in the living room together, though we are distant and using technology. But that's kind of the idea. And so, it's always important, I think, to share personal stories. So let me go to Sandy Johnson. Sandy Johnson is with the Minnesota Department of Health. She's a lead investigator with responsibility for right now dealing with COVID-19. Sandy Johnson, thank you for being here as well. Thank you for what you're doing in your profession. Tell me about what that means as a lead investigator. What are you discovering? What's your approach from your profession to dealing with COVID-19 coronavirus?
Currently, I am investigating cases of COVID-19 in the state of Minnesota. So we have a lot of people who have been infected. To date, I think it's around 27,000 and counting, unfortunately. And a lot of the people that I talk to on a daily basis are working, which is great, even though we see nationally, it looks as if a lot of people are not employed, but a lot of people have been infected mainly through their work sites. And so some of them have not been symptomatic, and so they're very confused, and a lot of them are from other countries. And so we mainly use language line interpreters, and I've been really amazed at the languages that I've had to ask for interpretation. And so people, the families are very concerned, particularly the people who are asymptomatic. They're very concerned about when they will be able to return to work because they have to provide for their families. And they're concerned if the results of the test are really valid because they feel fine. And so it's challenging getting them to understand that, yes, they feel fine and look fine, and I'm glad of that. Not everyone is on a respirator, but they have tested positive, and so they need to be concerned and continue to isolate themselves from their family members so they will not infect them. And so COVID is already a challenging pandemic because of the mutations globally. But on top of that, to add that to your ordinary stressors day to day, And language is very, very key in communicating. It really presents a interesting dynamic to get people to understand that this is something that they need to take seriously, even though you can't see it, you can't feel it, but you have definitely been impacted by it. And so it's always a challenge each time I'm assigned someone, getting them to understand this is something that you need to take seriously. And we appreciate the time that they give us in trying to relay information regarding safety and regarding next steps.
You're muted.
I'm muted, yeah. So you mentioned the 27,000. Is that cases or is that tested so far? Is that the number for the state of Minnesota? Break that down if you can.
Cases, those are confirmed cases so far.
Okay.
Yes.
And I understand that the flashpoints are Hennepin County and Ramsey County. Do you have details on the breakout for those counties?
No, not currently. I do not.
Okay, great. Okay.
Because I can say that in addition to Hennepin County may have the bulk of cases. The cases are everywhere in the state of Minnesota, from Blue Earth, everywhere. They really are. We have not to date, in my opinion, seen a lot of cases to date on the reservations. And that could be due to testing, but we have not seen a lot of cases to date. So
Okay.
like next week, there will be more testing events taking place in the Twin Cities, at Sabathani next week, as well as New Salem Baptist Church. So more information to come and more opportunities for people to be tested.
Tamiko Foster is with us. Tamiko, how are you?
Hi, I'm doing well. I'm sorry I missed the introductions. I actually had their bios. I don't know if they got a chance to be introduced, but thank you.
Well, you can introduce Dr. McKinney if you would, if you have his bio. Dr. McKinney, how are you?
Very well, thank you, sir. Thanks for having me.
Having some problems getting connected. Let me pull up Dr. McKinney's bio here.
Okay.
In 1 second. I know you sent me a shorter version. You had so much great work, Dr. McKinney, that we had to scale it down a little bit, but let's see here.
And while you're doing that, let me just remind people, this is our Friday session of Conversations with Alan McFarlane. We're live to Facebook and live on YouTube. If you like this conversation, we hope you do just that, like it, share it, and subscribe to us on YouTube. Our intent is to create a very informal conversation. On Friday, we call this Serving the Underserved, and with the graces of Minnesota members of the National Medical Association, these physicians and first responders and professionals in healthcare are coming into this conversation, and we think it's invaluable. So we thank all of you for participating in this. We hope that our audience really values and gains from the leadership, the service, and the knowledge that you share.
So I'm ready. So Dr. McKinney is a board certified occupational and environmental medicine physician who works as the primary provider at the Health Partners Riverway Clinic in Anoka, Minnesota. His general interests are in preventing work-related illnesses and injury and improving data-driven decision-making in clinical contexts, environmental toxicology, health equity, public safety medicine, and managing complex impairment and disability, and increasing the health literacy of patients and communities. His primary practice is local occupational and environmental medicine, and he is one of the few clinicians in Minnesota who evaluates work and community-related environmental toxicologic exposures. He focuses on individual needs, recognizes that every patient has their own unique situation, and each person's story is different as he attempts to get to know them as individuals and reach their goals. So I'd like to welcome Dr. McKinney.
Doctor, thank you for being here. So what's top of mind when you want to join a conversation and move the conversation forward in our community about how we respond to COVID-19?
Yeah, I think, well, there's been a lot of misinformation and mistrust out there, and I want to make sure that folks know they have some resources to go to in terms of other physicians out there, Black physicians, physicians of color, who can hopefully dispel some of the myths and make sure that people have the right information to feel safe and feel like they know what to do out there.
What are the myths? So let's start there. What do you think is the most egregious and pervasive misinformation that people are experiencing?
Yeah, and certainly, I mean, a lot of this was more prevalent a couple of months ago. I think some of this is being dispelled as we're seeing more and more of this even in our local community. But of course, that coronavirus was created by the government, or that it's something been designed to specifically affect communities of color more than other communities. A myth like that I've been hearing from people out in the community, and want to let people know. I certainly don't think there's a lot of truth to those.
There were rumors like Black people can't get COVID-19 early on. And so Black people were jokingly saying, I don't have to take precaution. But we found out how misinformed that was fairly early on. So how do we become victims of misinformation so easily? What do you think?
I think a couple of things in the history of Black folk in the United States have played into this. I mean, the Tuskegee effect, obviously, where there was people who were enrolled in the Tuskegee experiment and were not getting appropriate treatment once it existed. I think more contemporarily, we've seen problems with, for example, Henrietta Lacks and her cells being used for medical research, and her family not finding out about that for years, decades later, and then still not even really understanding the implications of what that meant. Of course, aside from the general issues of systemic and structural racism that exist in the United States and make people, even including myself as a physician, sometimes anxious about going into the doctor.
Yet you still want to let people know today that there are alternatives. And despite this history of at least skepticism, we should be rethinking or thinking differently about how we engage the health system, don't you think?
Very much so. I mean, quite the opposite of the myth that you said, about Black people not being able to get coronavirus. I think early on, a lot of other people were saying, well, coronavirus is sort of an equalizer. It's going to affect all people equally. And we actually found out it's not true also. Black people have been profoundly affected in terms of morbidity and mortality related to this disease. In New York, we were seeing twice the death rate in Blacks than whites. In our neighbor, Wisconsin, we've been seeing about 18 times the death rate. And that isn't because Black people are intrinsically more likely to get this disease or intrinsically more likely to get severe disease. But of course, it's a consequence of some of the social determinants of health that affect Black people in a number of other ways, such as, for example, having higher rates of chronic disease, such as diabetes, heart disease, asthma, things of that nature.
How does that work? Explain that. What puts you at greater risk if you have hypertension, if you have heart disease, if you're diabetic? What is it about that condition that makes you more vulnerable than, say, a more healthy person?
Well, it kind of varies from disease to disease. I mean, we're familiar with the fact that this particular coronavirus, COVID-19, causes severe respiratory disease. So from a perspective of somebody with asthma, for example, who may already have trouble with their airway or trouble with breathing, this can exacerbate that problem or make it worse. So those folks may end up having worse breathing problems. With respect to heart disease, we're finding out more and more over time that COVID-19 actually has pretty profound effects on the blood vessels and actually puts a significant degree of stress on the heart in addition to what's already happening to the lungs or the respiratory system. With respect to diabetes, that's a disease that, of course, can affect lots of different systems in the body, including your cardiovascular system, your blood vessels, including your hormones, including your nerves. And so somebody, with more severe diabetes will already have a compromised system potentially in a variety of ways. And so it's not just these few diseases, but all sorts of chronic diseases that have these sort of greater impacts on health overall are all going to be more particularly affected by infection with this virus.
And Dr. Tamiko Foster, jump in. And so what does it mean for us in terms of educating ourselves? Number one, about this particular challenge of COVID-19, but also about what our attitude and awareness should be about medicine and healthcare, and our need to have proper, effective access, and to use that. I have a relative who just had a stroke, and this is one of my brothers who never went to doctors, and just macho guy, right? Good guy, good brother, but late in life has a stroke. And what is it in us that had us feeling like we never needed to see a doctor? So how do we address that in the culture? So I think he's not alone. I think too many of us say that, as long as I think I'm okay, I must be okay. So I don't even check. That's a problem.
Right. No, that's a great question. And I'll give certainly my input. And I would also love to bring in Chief Adams, who does a lot of work around, I don't know if he mentioned this in his introduction, around health and wellness. But I think in general, from, as Dr. McKinney mentioned, it's just a general mistrust, which is actually a valid mistrust. I mean, we can't ignore that those things didn't happen and continue to happen to Blacks in the medical system. It doesn't mean that we're all out to, personally as a physician, I know I'm not out to harm anybody or cause any harm, but certainly when the medical system and different institutions in general, when we're looking at the policing and the law system and all these systems, sometimes people view us in that same basket. And so there's a general mistrust for anybody that is related to any type of system because of the systemic inequalities that have happened over generations. So I think in particular, one of the things that I tend to advocate for is the empowerment of the individual. While it's important for us to continue to work on health policies and reform, because those are the things, and that sounds like a big thing at times, how do you change a system that's built on inequities and structural racism and inequalities? But it's really the people that are in those systems, and how do we get the right people in those systems that are going to be able to advocate and do what's right? So that's one piece. So having the right people in place to help have policy reform and put the correct systems in place for people to be able to get the care they need as it relates to access, as it relates to getting the type of care that they need. So even when you are able to go get the care, often for Blacks, it's not the optimal type of care that we receive. So being able to dismantle that system and start over is going to be critical. And that's the importance of having the right people in place with the right mindset. But aside from that, I advocate for not just waiting. We definitely part of us got to have to pull yourself up by your bootstraps, but we also have to, really empower individuals to take ownership of their health. So that goes from, I caught the tail end of the conversation with Chief Adams talking about ways to improve our health, increase our immunity, and do the things for us to that we can actually take ownership of in improving our health to improve these outcomes. But one of the things that I did want to say before I turn it over, it was a profound statement that was made at the memorial service of George Floyd yesterday. In this midst of this pandemic and us talking about COVID, which is still an important conversation because COVID didn't disappear, but it was his best friend that made the comment that George Floyd didn't die from COVID. And I thought that was a powerful statement because, we're really looking at the issue of structural racism and police violence also as a public health issue. And why society has spent so much time and resources in battling this epidemic, this pandemic of a virus, we have ignored the pandemic of racism and police violence that has plagued our communities for generations. And the impact that has on our physical health and well-being. Dr. Boyd talked about that last week as we talked about people who witness a murder in their communities or police violence, how studies have shown that the mental impact of that is similar to about a person living with a chronic condition such as diabetes. So we have to be able to bring the social constructs into these conversations and our overall wellness when we're talking about the reason why disease states such as diabetes and obesity, high blood pressure the root of why they are so high in our community also ties into the fact that we've had this mental oppression for generations that has impeded our ability to be healthy on so many levels. So the metaphor of getting the knee on the neck extends beyond the actual police knee on the neck of George Floyd. It was very well spoken as a way of how the systems has placed an oppressive stance on the necks of Black and brown people, and especially Black people in the communities. So I think that's an important conversation. I would love for some of our guests to speak a little more about that.
I think that's a powerful analysis, Dr. Tomiko. And so let's go back to Brother Kavis Adams, Chief Adams. Weigh in there. You know, we talked briefly about your educating people about personal ways to fortify with nutrition and lifestyle. But talk about, if you would, the things mentioned by Dr. Foster a second ago, the impact of both COVID-19, health, nutrition, et cetera, how individuals are impacted by it, but also the social and environment that sustain the disadvantage that we experience as African people, as Black people.
Okay, yeah, sure. Thank you. First of all, I want to say that's very powerful, tying in the oppressive nature, sort of the real and the imagined, that seem to sort of converge into our same reality. I mean, when you have a history of mistrust, which is merited when dealing with certain institutions, whether it's law enforcement, you know, or in some cases the health industry, sometimes the lines get blurred between what's actually happening and what one is expecting. And they can be equally powerful. The anxiety that one feels, you know, when, you know, going to the doctor because of, you know, the historical context that we have. And I think sometimes it's a web, it's sort of a network of what we face in our realities, meaning harm that has actually been done to us, and then things we may see through the media. And when we identify and we empathize with those that look like us, it sort of compounds the mindset and the awareness that can sort of escalate into a hyper awareness. And I think sometimes that's tied to sort of the comfort behaviors in terms of like maybe not eating the best, most nutritional things, because, or, you know, alcoholism and other sort of negative behaviors that sort of can cascade into, you know, exacerbate the problem. And when it comes to us facing real barriers and real challenges in the world, you know, we find ourselves at a disadvantage. When COVID comes around, you know, we tend to have the most compromised immune systems, the most negative attitudes, the most manifest paranoia, and certain other things that didn't just sort of come out of nowhere instantly. You know, there's a history behind that. So there's an educational piece that should come into play in terms of fortifying our people, not just realistically in terms of nutrition and exercise and behaviors, but also an educational piece to where we can regain trust, you know, with key members in the medical, you know, community and establishment, because we have to, you know, trust somebody. You know, you can do a lot with good nutrition and exercise, et cetera, but at some points, you know, MRIs are necessary, or, you know, medications are necessary in some cases. So I think it's great to have people, you know, on the panel, Dr. Foster, and I forget, sir, your name is not in your
Dr. McKinney, I apologize.
Dr.
McKinney and Sister Johnson. It's good. That's a good start, and that's what's necessary. Moving forward, I think what happens is the expectation can be reinforced by reality. So I think speaking about things and disseminating information is a good sort of preliminary thing. When people in reality see actions taking place, and they see their actual reality changing, that's sort of a positive feedback loop. So once people see more healthy African Americans, and we challenge people to plot their progress to better health, and that sort of spreads through the community, I think that trust and that sort of expectation can help change things. And I think this tragedy that happens, they say the true essence of a tragedy is not just the sad part, but the tragedy is never complete until you have sort of the reprise, which is the positivity, is the silver lining, is the new day that actually means tragedy. And I think this tragedy, which is, this example, explicit example of abuse and, you know, the unwillingness or inability of the injustice system to prosecute and act speedily. This is a chance, and this is a moment where we have the mic, as it were, and people all over the world are watching. And I think there are all these different aspects of our reality and existence. We have a stage where it's exposed, it's raw, but it's exposed. And I think we have an opportunity to move forward and build on this, not just with law enforcement, but yeah, in the health industry. Those of us that are in these different industries to, be honest about the history we sort of inherited when we took on a job. We're not working at Xerox. We are in positions where we affect people's life and death and future. And I think just sort of being educated and honest about what we've inherited and what we can do as individuals in our community, but necessarily representatives of these institutions in a way, to sort of be those ambassadors, and not just for the institutions, but how we plan to own them and change them moving forward and make them ours.
Sandy Johnson, I want to come back to you. Those are good comments, Chief Adams. Thank you so much. Sandy, jump in here, just impressions of the conversation. As you jump in, think about this. I'm looking at the video of George Floyd, 8 minutes and 40 seconds. And in that 8 minutes and 40 seconds, I'm seeing not only the specific tragedy that is unfolding in front of a video camera of this interaction between an individual and another individual, or the four and the one, and the people around. That's happening real time. But I'm also looking at it in a with a metaphorical lens, and that's what came up again and again in the ceremony, the memorial services yesterday. That this 8 minutes is a metaphor for the history of Black people in the United States, and some could say it's a metaphor for the they call it the Ma'afa, the history, the 500-year history of interaction between Africans and Europeans. So you can look at this at all kinds of levels. There's the actual specific incident, but it's happening inside this COVID-19 environment. How does one inform the other? How do we learn something about what's happening even with COVID as we look at what's happening with George Floyd? That's kind of a convoluted question, but if you get my drift, just respond.
Well, I'm not sure if that's a question. I heard a dissertation, but anyway, what I will do is try to see, my take on it is that when you, as an African in America, live in an environment where it is permissive to have your life squashed out like an insect, it's challenging to be positive regarding change, regarding protection, regarding people who look like you actually having your best interest at heart. Like Dr. Foster said, because of the structural racism and the insensitivity of those who comprise that in the system, it's challenging to me to get people to take seriously another pandemic as a priority, because you already are living in a warlike state on a daily basis, being a Black in America. male, female, adult, or child. At any given moment, your life can be taken away and business goes on as usual. And then to have it played out, like you said, of video lynching, to have it a global symbol that your life doesn't matter, that's challenging. And when you're not given the opportunity, in my opinion, to have a real outlet, for whatever reason, we as African Americans, we have challenges in addressing the mental health, just the stigma of mental health services. And I understand that because oftentimes mental health professionals or practitioners may not look like you. And so they don't have the same frame of reference that you come from. They don't come from where you do. And so they don't have the compassion and sometimes choose not to identify with some of the situations that you endure every day. And so I think it's important for us to realize that our lives matter irregardless of what's going on, what pandemic, what the flavor is of today. And violence against us as a people has been so generational and so historically accepted, that it's hard because you feel like you are never safe, in my opinion. Even in your home, we've had within the past 2 years, two assassinations of Black people sitting in the privacy of their own homes, and you're still not safe. And when it's televised and the people who perpetrate this crime on you and your community get off, it's like, how does my life matter? And how is COVID important? Something I cannot see, something that's not tangible, but it affects my very being. So I think a lot of ways need to be taken in order for us as African Americans to realize that it's important to value and prioritize our health, to exchange one crunch, like the crunch of a potato chip, for another crunch, like a carrot or a cucumber. And the summer makes it easier. And I know that's simplistic, but it's like, we are the only people, in my opinion, who are going to save us. We can't wait on anyone to save us, because in our system, in this America, it's not going to happen. And so we have to consciously make decisions on a daily basis that, given the resources that are available to you, we have to make better decisions. We have to make decisions to walk more, to do something simple like get outside and get vitamin D naturally, not just through a pill form. So I just said all of that to say it's important. We have to be the ones to send the emails to the legislators, to the chiefs of police, of every place, to advocate for ourselves. It's great. It would, if other people advocated and considered and prioritized our lives, but we have seen that has not been the case in the majority, unless there's a magnificent situation like the one with Mr. Floyd. But Mr. Floyd's situation comes behind several generations of lynchings. Now this is just public. So we have to be the one to take responsibility, more responsibility for our lives, for our own personal decisions, because no one is going to do that for us, and no one is going to advocate on our behalf like we can. So we just have to be the ones to sit at the table, to utilize social media for positive platforms, and to make sure that we put our monies where our mouths are and our wallets, to make our voices heard. So.
Dr. McKinney, jump in, just build on that if you would. How does that become actionable from your vantage point as a provider, as a healthcare professional, as a business person in the business of health?
Yeah, I really like a point Ms. Johnson made that essentially, we're going to have to do some of this for ourselves. I tell patients all the time, the first principle of medical ethics is patient autonomy, meaning you get to choose what's right for you. I think one barrier that African American patients have felt coming into the doctor is some of this historical paternalistic view in medicine that, the doctor's telling you what to do. And if you don't do it, you're a bad guy. Why haven't you taken your blood pressure medication? Why haven't you quit smoking? And to be honest, I don't believe really in my heart of hearts that that's our role. Our role is to help you figure out, what are the goals you want for your health and how to help you get there. So if somebody says, well, I am willing to treat my blood pressure, but I still think I want to keep smoking for now. Maybe I'll try to quit later. Then that's supposed to be okay. And somebody shouldn't leave my office feeling that I'm judging them for that, or I'm in some way not prepared to help them because they aren't doing every single thing I want them to do. That's unrealistic. It's even unrealistic for me as a doctor to pretend that I don't have vices and don't, eat a hamburger sometimes or eat a bag of chips, would be ridiculous. And so I think making sure that people know they can find a doctor that may make the safe space or may make the space safe for them and where they can be themselves and express themselves is very, very important. And maybe we need to do a better job, people like Dr. Morgan and myself, and communicating that to our colleagues to let them know, in some degree, how vulnerable African Americans are because of all the things that Ms. Johnson and Chief Adams are talking about, the years and decades and centuries of feeling like, what, our health and our lives don't matter.
Dr. Tomiko?
Yeah, I just wanted to, I don't know how we are with time, but because we have two people on the panel who kind of have an expertise in this, there was big conversation or a hot topic right now, and I don't know how much time we'll have to address it, that ties in George Floyd, the protests, and COVID, is this issue of contact tracing and also the privacy and confidentiality around that. There's been a lot of concern around a statement that was made by an official in Minnesota regarding the ability to essentially contact trace patients who are also protesting. So I would like to, I know Dr. McKinney, you have a background in informatics as well, and Ms. Johnson, Sandy, you did a lot of that contact tracing with MDH as it relates to COVID. And that's also a huge area of mistrust. So here we are again, where we're allowing people into our personal spaces through our phones and others for one thing, and they're using that as a potential abuse to get other information. So I just wanted to open that conversation and see what thoughts are about that, because here we go again with another reason to not trust the system.
To date, I do case investigations with COVID. And before that, I did disease investigations, sexually transmitted diseases. So to date, Minnesota, the Minnesota Department of Health, to my knowledge, we have yet to implement a system to where we will be following up with contacts of just every case, because it is a huge process. For cases primarily who are involved, who are positive for COVID and they work in the long-term care facility or health facilities, we definitely try to contact the people who they have been around, who they've been exposed to, and just let them know that they've been exposed to a positive case of COVID and they need to quarantine for 14 days. But it's going to take a while, in my opinion, before we have the capacity to really follow up on every contact of a person who has tested positive for COVID. It's something that needs to be done, and that process to build the capacity and to train, that's going to be quite a process, even though there are trainings available that are actually free for contact tracing. But it's going, certain states such as New York and Atlanta, They have implemented systems to follow up, but it is going to be quite a process to implement and to build the capacity to. But definitely I see the point in people being concerned about giving information about their contacts. And when it is implemented in the state of Minnesota, we definitely will make sure that it's confidential, because that is the key. We can't say, Bugs Bunny, you've been exposed to COVID-19 from Daffy Duck, because we don't know what the fallout will be between that relationship. And that is not something that we do with any of our infectious diseases. So we try to make sure that we maintain confidentiality by just letting someone know that they've been exposed to an infectious disease without revealing the source, because that is a breach of confidentiality, and that's really not our focus. Our focus is to always make sure that person is informed with the information so they can make the right decision to seek medical care and to definitely adhere to the advice of.
Okay, there you go.
No, I'm
I
sorry.
wanted to interject quickly because Dr. McKinney does work with informatics, and the main issue was about just kind of the geo tracking and Bluetooth and being able to identify people who have been in groups. So I will give this message. They're recommending that anyone who participated in protests or just who've been in large groups recently to get tested about a week out, or certainly sooner if you're having symptoms. But even if you're not having symptoms, everyone should they're recommending that everyone get tested if they've been a part of a big group. But it really stems around just the inability of people to take that information through geo-tracking and other Bluetooth technology to access your whereabouts. So I don't know if Dr. McKinney had more input on that.
Yeah, a few points there. One is, yes, there was guidance that came out from MDH earlier this week recommending, certainly for first responders who have been working around these protests, to get tested, even if asymptomatic or concerned about exposure. The same thing would be true for individuals out there in the community as well. One challenge or one disconnect that's been happening is that many health systems are not prepared to test asymptomatic individuals, and so people actually have been getting turned away. I believe Hennepin County Medical Center downtown is doing some asymptomatic testing. Don't hold me to that, but I know other institutions may not be. So I don't want people to be frustrated when they go and try to get tested, because I think institutions are trying to respond to that guidance from MDH very fast right now and in real time. To your points about wearable technologies and geolocation, I think right now that's not been well implemented in the public health setting, maybe other than in very particular foci or like very particular applications, or in maybe more research settings. But certainly down the road, I think optimizing that type of technology in a way that makes people feel safe, maybe for example using something like blockchain technology that people are using for cryptocurrency, could be helpful. But I don't think we're there yet. To Ms. Johnson's point,
explain it to me. I guess I'm not really sure that I know what you mean about the technologies that are available, and this is associated. I'm imagining, kind of wildly, a sci-fi scenario where I'm being cyber tracked, and not to my benefit, but to my disadvantage in some way. Now, can you address that fear? What are you talking about, Dr. McKinney?
Sure. Well, right now, I think if we had, for example, everybody was uploading their Fitbit data to Minnesota Department of Health, some of those fears might be more close to reality. Fortunately, that's not really happening right now.
Mm-hmm.
I think we actually need to be more concerned about how private companies are using our data, such as we saw with Facebook and Cambridge Analytica, or, what is, for example, and I'm just picking out Fitbit because that's a common one.
Mm-hmm.
What is Fitbit doing? Or what is Apple doing with your iPhone? Or what is Google doing with your Android phone? And I think there's a lot of work behind the curtains that we don't know what's happening there. But at the end of the day, it technically is illegal for them to use data outside of the intended uses. So I don't think some of those fears exist completely in reality, or at least not in the way that we perceive them. One thing I mentioned, and probably it was my own fault for going down this rabbit hole, was blockchain technology, which is essentially distributed security to the point where essentially every node in the system would have to fail in order for the security to fail. That's how Bitcoin and other forms of cryptocurrency work right now. And a lot of people in the healthcare IT space are looking at that as a more secure way to distribute security across the entire network and avoid single points of failure in the way that we're sort of concerned about. One other thing I think worth mentioning with regards to what Ms. Johnson mentioned is Minnesota actually has very, very tight data privacy laws as it pertains to public health. I'll give an example that's relevant to Chief Adams here. So I had been at a conference about Florida about firefighters and cancer. And in Florida, the University of Miami had linked their state cancer registry with state fire marshal data to try to look at some of that. And I asked one of our state epidemiologists, like, gee, well, why can't we do that here? Well, it turns out our privacy laws around public health are so tight that we actually cannot connect databases like that except in a very de-identified way. And so there are lots of barriers to overcome. So I guess at the end of it, the summary of what I'm saying is, I think some of the data privacy fears, certainly as it pertains to protesters right now, aren't easily realizable simply just because the government doesn't really have access to your data in that way right now. And secondarily, I'd like to give props to our state public health department, the Minnesota Department of Health, because I think we have one of the best or the best public health agency in the country. And I think from a legal perspective, we take these issues of data privacy extremely seriously.
Really do.
I agree with that. And I will say, though, and I'll just say we'll stay tuned for this because we have another medical professional that's part of our group who's writing an article that's going to talk more about this contact tracing and some of the confidentiality. So we did reach out to MDH for a comment and regarding the recent use or possible use of them using some of the tracing apps for the protester to contact them to tell them to get tested, or they may have been around someone to get tested. So it is going on. And the comment that we've gotten initially is that whatever the government, from the governor's office, they can basically override that. And so there was a breach from what our understanding is. We don't know the extent of it. And their response was because the governor was able to basically override that mandate. So I think there needs to be a very comprehensive reform as it relates to the policy, as it relates to data sharing and the ability to opt in. I recently got a software I have an iPhone, and they did have an update. And if I hadn't looked closely, I would have just updated. But part of the update was to allow contact tracing and geolocation and tracking. And I just kind of took a pause until I further understood what that would include. So I think as we continue this conversation around keeping the public safe from viral and other types of pandemics, and from a public health standpoint, also being very mindful of what it means as it relates to confidentiality, privacy, and data sharing.
So I was in conversations with several other professionals, including Commissioner John Harrington, the Commissioner of Public Safety, this past week, and others. And one of the questions that I had was, how do we, in the protest environment, try to encourage and allow the separation of those who are present for good reason, that's righteous indignation, to protect and preserve our rights. How do we separate that group and from that group, those people that have other motives and they're bad actors who use the cover of our anger and of our protests to commit bad acts, to do the arson, to do the looting, or to instigate it? Then maybe crowds follow, but a lot of it is set up by people that arrive with intentionality. So I'm thinking, wouldn't it be useful, and I haven't said this before, if we encouraged all the people who show up at a rally to take a minute and take a picture of each other? Now, that's simplistic, and it may be more dangerous than helpful, because you'd be creating a database that shows everybody there. And if you do that, are you in fact violating privacy by creating that database, by encouraging or asking with intentionality people to do that? And that kind of applies to the question of contact tracing in a certain way as well. And you're saying, Dr. Tomiko, that there are concerns about breaches of security, and that people have to be mindful about that. At the same time, we want to do all we can to ensure public safety. How do we navigate? What do you think?
Right. No, I think you're exactly right. And I'll actually let someone who was actually on the first lines, Chief Adams, you were around with the first nights of protesters. And I think part of what you were saying, they were trying to distinguish who was the peaceful protesters from the outsiders. I don't know if you want to comment on that first. If not, I can take it back. But you were on the first line as it related to that.
Yeah, I actually do have something to contribute to that. I know I can tell you actually the first couple of shifts that I worked following the death and the sort of increased visibility and the protesters that showed up in those manifestations. I had my car while I was driving through a crowd to get to one of those initial sort of landmark fires, which was at the AutoZone over South. The back window busted out. My tire shot out, from a probably 22, 25 caliber.
In your
While I
personal
was in
car
the
or
vehicle.
personal car or fire department?
Fire car. No, I wouldn't have been anywhere near my personal car. But yeah, so tying that in, there were a lot of scenes that we had to abandon because there were, fireworks and rocks and sort of low caliber sniping going on. And we ran 24 hours consecutively without rest for those first couple of shifts. 24-hour, two 24-hour separate shifts. Fires were springing up all over the place. And our responses were delayed as a result of that. Once, and what I saw from the front line is the community, people of the community began to sort of vigilantly walk through their alleyways, walk through sort of the side, the shadows of the businesses. And we found strategically placed containers of accelerants, lighter fluid, Molotov cocktails at the ready, bricks, things that were there strategically placed at sort of locations around the city where individuals who were in the sort of know and the network could drive by, pick up a brick, lob it through a window, and follow with a cocktail. Once we started, the community got active in identifying sort of those sources, and that sort of ammunition paraphernalia started to turn it in and began to sort of be on the lookout and sort of challenge people and catch them on picture and video. And that sort of speaks to what you said. There is no reasonable expectation of privacy when you're in a public space. Anybody can sort of tape you and photograph you. Mm-hmm. So that did start happening, and I got to tell you, it felt that it's almost like dropped off a cliff. The amount of fires that we had, the amount of looting that was going on, once sort of those bricks and that spirit of anarchy was addressed, and a lot of those individuals were taken into custody. And I know that St. Paul said after over 100 arrests of people that were found sort of disturbing and, sabotaging the purpose of the protest, out of those 100 arrests, none of them were locals. Not a small percentage, but none of them. Now, I don't know how much beyond they captured of that 100 as a sample, but in that initial 100 at least, none of them were locals. Now, the media mainstream, they don't attach nationality or race or ethnicity to these this outsider sort of title. But I think we know, there are videos sort of circulating around where you have people that came into our communities armed with specific purposes, and hopes that they wanted to see, sort of, taking an opportunity on this tragedy to sort of start problems and race problems and everything. And I think that was just to speak to your question, that was very effective. And I think if we can encourage our communities to do more of that, cowards don't like to be seen. They don't like to be challenged. And though they ride around with automatic weapons and, they're bad and all this, people with cameras that are vigilant, that are watching, I can tell you frontline, it helped to just solve mostly, if not all of those problems around the looting and the arson.
Dr. Foster, I'll have you wrap it up. Your nameplate says Tamiko Foster. I call you Dr. Morgan, so I'm gonna let you explain that, Doctor.
We go through this every other week.
Yep, we do.
I was previously Dr. Morgan, but my new name is Dr. Foster.
Okay.
But most people know me as Dr. Morgan in the community because that was my name for many years.
Okay.
But that's fine.
Okay.
Call me Tamiko too.
Dr. Tamiko, okay.
Dr. T, Dr. Roxanne, no. But yeah, I'm so grateful. I missed the initial discussion of this conversation, but I'm grateful, and I want to thank all of our panelists. The time just always seems to go so fast, but we'll continue the conversation. I think some of the highlights of this discussion today was just still, raising awareness, of course, of George Floyd and the public health issue of structural racism and police violence in our communities, as well as intersecting and not forgetting about the current pandemic of COVID, which is still very real for those of us who see it every day from a medical lens, in addition to how do we continue to educate and bring awareness to our communities in a way that is sensitive to the mistrust and some of the historical pressures and oppression that's been placed upon us, and how do we find that intersection to continue to provide the care and show up and build that trust. I mean, we have to be able to be in a place to rebuild it and not assume that it's going to be given to us. I think we also will continue to think of ways that we can, in our individual practices and the work that we do every day, to empower people to lead healthy lives and to take on that ownership for themselves and not wait for a system to provide that, because we've been let down by that. And I just want to encourage everybody just to breathe. We talk about that 8 minutes and 46 seconds of when our brother Floyd did not have the ability to take a deep breath. One of the things that I've been doing is just remembering to take deep breaths, throughout the day as a reminder of what we're doing, the fight, but also to improve our health and mental well-being. So
let me tell you one thing I'm taking away from this conversation, and you tell me if I'm right or wrong, but I see a headline saying, if you were at any of the celebrations, if you were at any of the protests, you ought to be tested.
Yes.
Am I correct?
Absolutely. Even if you're asymptomatic, but you don't want to go right away. You want to space it out about 5 to 7 days after your last group gathering, because you might get a false negative, meaning they'll test you and it's not showing up yet because the body hasn't had the ability to really have the response. So absolutely, everyone should be tested if they were any type of group setting about 5 to 7 days out, right away if you're having symptoms.
And if you get a test, say 5 days from now, you come out negative, does that mean you should be feeling that you're not vulnerable in the future, or activity in the future may require testing in the future?
Absolutely. This is very mobile. It's very fluid. So a test in one space and time is just a negative test in that point in time. So you can literally be negative today, and 3 days from now you can be positive. So it really depends on your exposure, and that's just how the reliability of the test is. So I don't want people to have the message that, I was tested negative, I'm good. That's how some people think, but it's really just that test in that point of time that was negative.
Okay. Dr. McKinney, you were going to say something?
I just wanted to ask Dr. Morgan if she wanted to comment on the difference between nasal swab testing and the blood or antibody testing, just so people can take your advice and not be confused about those, or I can talk about it too.
Sure, I can speak real briefly to that. Essentially, if you're testing for an acute or active infection, as we call it, they'll take a nasal swab and they'll stick it up your nose. Some of them will do what we call an oral pharyngeal test, which they'll swab the back of the throat, similar to if you've ever had a test for strep. And that's going to check for your acute, or if you're actively shedding the virus. Now, it's been estimated that the active shedding of the virus can happen anywhere. Usually they'll catch it around day 5 to 7 is what most of the literature is saying. And most people, that'll start to go away around day 14, which is why they kind of gave the 14-day as a guideline. But there have also been evidence to show that some people have had a positive active PCR, or basically testing for the DNA of the virus, that has lasted up to like 30 to 40 days. Now, whether or not they're still infectious during that time, we don't know for certain. The antibody test, which has been a hot topic because it's been linked to, at least on a political level, of opening up the economy. Everybody wants the economy to open up. If we can prove that people have antibodies or that they have been exposed to the virus, that they're good to go, we don't have to worry about them people. So that's a blood draw. And like any other antibody test, it basically checks if you have been exposed to a type of virus or infection, right? But the problem with these antibody tests is just they're not very good. I think I've heard numbers of some of them being as high as 30 to 50% inaccurate. So you may get a false negative test saying that you never were exposed to a virus when you were, or you may get a false positive test, which tells you that you were exposed to COVID. So you're thinking, oh, I can go out, I can be around people, I don't have to wear my mask. But that can also be falsely positive because we do know that some of these tests have a cross-reactivity to the coronavirus that also causes the common cold and others. So the tests are not perfect. It's a starting point, but it is not perfect. And I would recommend anyone not to totally feel 100% confident based on any test.
Well, the time goes fast. This has been a great program. Thank you so much, Dr. Tamiko Foster. Dr. Zeke McKinney, thank you so much. Sandy Johnson from Minnesota Department of Health, thank you so much. And Chief Kavis Adams, thank you so much. I was going to ask you about your career, Chief, but out of time. We're going to come back because you know what? The power of this conversation is in learning your personal stories too, how you've come to this moment and how you are motivated to bring the passion that you bring and the intensity that you bring to the service of our community. So we're going to all come back over the next several weeks and just spend more time on your story. And my goal as a reporter is to help weave your story because your story is the solution, to weave and to tie, to marry your story to the solutions that we are seeking and that we are delivering to ourselves and to humanity. So thank you.
Next time.
Yes.
Next time I have a statement from the Black Firefighters Association. We'll do it.
That would be awesome.
All right.
Thank you all so very much. We'll see you next Friday, Serving the Underserved. Thanks so much to the National Medical Association, the Minnesota affiliate. We'll see you next time. I'm Al McFarlane.
Thank you for the opportunity.
Thank you, Al.
Thank you. Here we go. Good job, Calvin. So if you would, drop it into Rev right away.